little blog I wanted to read here from the Aging and Health Technology Watch. So, saying the tech user experience for older adults needs a reboot. Is the user experience deteriorating? Tech user experience experts focus on everyone except older adults, but there's a problem. From AARP's Tech Trends Survey from 2024 and their 2023 guidance from AARP on their inclusive design practices, it's clear, and as the AARP report notes, no one prefers badly designed over complicated products. Despite preferences, surveys show that today's user experience for older adults is more problematic than ever. All are confronted with buggy software and frequent bug fix releases, such as a problem on iPhones that an embarrassed Apple redirected software work towards fixing. And Google is no better with Pixel phones. Smartphones and smartwatch adoptions highlight UI consistencies. Broader older adult adoption of smartphones has inadvertently introduced more, not fewer barriers to achieving digital competence. As the screen size shrank in comparison to PCs, Macs, and iPads, the differences between user interfaces became more obvious. Developers have adjusted features to utilize more icons and fewer words, creating confusion. In the same app on a PC, iPhone, and Apple Watch are strikingly different, assuming the app interface is even visible on the watch. Older adults are pushed online into a standards-free world. The patient portals are now required for access to personal health data and to minimize clipboard use, and has spawned a raft of advice about their creation. However, the lack of standards in creation has resulted in multiple styles or formats and for different physician practices, with the clipboard still alive and well, and the sign-on processes that may be difficult on a PC and perhaps impossible on a smartphone. To verify that you are, an authentication process requires two devices to log in, one which is a phone, cumbersome enough to invite satire on the Wall Street Journal. Convenience and portability today compete with clarity and usability. There's no turning back the clock. Older adults will own smartphones. They need them to function outside the home, and they will learn enough to do those required tasks on whatever apps are required. GPS directions, chat with grandchild, book a restaurant. You have observed a couple in which one of them is more proficient and assigned those tasks. But even the proficient will be frustrated by a forced change. They will delay the upgrade to a new phone because of a hassle factor. They will wish for a simpler time when they sat in front of a relatively large screen. They used relatively few apps, and the login processes were simple and passwords were short and easily reused. Simpler days are gone for good. What is the fix? Are there innovations on the horizon that will improve the tech user experience? Should there be more training for users, obvious and available when a new device is purchased or an upgrade is completed? Should AI software direct when a user is having difficulty and chime in with suggestions? Should improvements be focused on older adults, or is this really a design for everyone opportunity? Are tech developers so insulted from users they don't see the deterioration of experience as it happened? And so, lots of different commentary and thoughts on that for sure. We don't know what it's going to be. I see a lot of older adults that are pretty tech savvy, to tell you the truth, but those that are having a hard time have a hard time, right? So how do you do that? I don't know. I like probably top comment on this blog. A lot of mainstream products are adapted for older adults after launch once the market share opportunity is recognized rather than designed with them involved from the beginning. Products designed specifically for older adults are often less interoperable with mainstream tech and can fail to respect the agency of older adults. I think the key here is involving older users in design from the beginning on both mainstream and senior specific products. I'm hopeful there will be a blend of both approaches in the near future. And that's a considerable, concept there. And I don't know how you do it in the tech world, but how do you work with seniors to actually develop a senior friendly technology, especially when seniors are all at such a different level when it comes to tech, right? And so the tech just keeps advancing fast, but what parts of our society are not advancing with it, right? Interesting. Anyways, let's move on. Enlightenment Hour. Talking a little bit about how President's Day went from George Washington's modest birthday to big sales and 3-day weekends. Like other founding fathers, George Washington was uneasy about the idea of publicly celebrating his life. He was the first leader of a new republic, not a tyrant. And yet the nation will once again commemorate the first U.S. president today, 292 years after he was born. The meaning of President's Day has changed dramatically from being mostly unremarkable and filled with work for Washington in the 1700s to consumerism bonanza it become today. For some historians, the holiday had lost all discernible meaning. Historian Alexis Coe, author of You Never Forgot Your First, a biography of George Washington, said she thinks about President's Day in much the same way as the towering monument in D.C. that bears his name. supposed to be about Washington, but can you really point to anything that looks or sounds like him, she said. Jefferson and Lincoln are presented as people with limbs and noses and words associated with their memorials. And he's just a giant granite point. He's been sanded down to have absolutely no identifiable features. Here is a look at how things have evolved. Washington's birthday. Washington was born on February 22nd, 1732 on Pope's Creek Plantation after the near Potomac River in Virginia. Technically, though, he was born on February 11th under the ancient Julian calendar, which was still in use for the first 20 years of his life. The Gregorian calendar intended to more accurately mark the solar year, which was adopted in 1752, adding 11 days. Either way, Washington paid little attention to his birthday, according to mountvernon.org, the website of the organization that manages his estate. Surviving records make no mention of observances at Mount Vernon, while his diary shows he was often hard at work. If he had it his way, he would be at home with his family, Coe said. Maybe some beloved nieces and nephews and friend Marquise de Lafayette would be ideal. And Martha's recipe for an indulgent cake, but that's about it. Washington's birthday was celebrated by his peers in government when he was president mostly. Congress voted during his first two terms to take a short commemorative break for each year, with one exception, his last birthday in office. By then, Washington was less popular, partisanship was rampant, and many members of his original cabinet were gone, including Thomas Jefferson. One way to show their disdain for his Federalist policies was to keep working through his birthday, Coe said. The Library of Congress does note that a French military officer, the Comte de Rochambeau, threw a ball celebrating Washington's 50th birthday in 1782. After his death, Washington was very aware of his inaugural role as president and its distinction from the British crown, and he didn't want to be honored like a king. Still, a market for Washington memorabilia sprang up almost immediately after his death at 1799 at age 67, with people snapping up pottery and reproductions of etchings portraying him as a divine figure going off in heaven. Even in that early moment, Americans kind of conflated consumerism with patriotic memory, says Brugman, whose books include Here George Washington Was Born, Memory, Material Culture, and Public History of a National Monument. It wasn't until 1832, the centennial of his birth, that Congress established a committee to arrange the national parades of orations and festivals, according to a Congressional Research Service. And only in 1879 was his birthday formally made into a legal holiday for the federal employees of the District of Columbia. The official designation is as Washington's birthday, although it has come to be known informally as President's Day. Arguments have been made to honor President Lincoln as well because his birthday falls nearby on February 12th. A small number of states, including Illinois, observe Lincoln's birthday as a public holiday, according to the Library of Congress, and some commemorate both Lincoln and Washington on President's Day, but at the federal level, the day is still officially Washington's birthday. By the late 1960s, Washington's birthday was one of the 9 federal holidays that fell on specific dates on different days of the week, according to a 2004 article in the National Archives Prologue magazine. Congress voted to move some of those Mondays following concerns that were in part about the absenteeism among government workers when a holiday fell midweek. The lawmakers also noted that clear benefits to the economy, including boosts in retail sales and travel on 3-day weekends. The Uniform Monday Holiday Act took effect in 1971, providing President's Day to the third Monday in February. Sales campaign soared, historian C.L. Arlebade wrote in the prologue. Brugman said Washington and the other founding fathers would have been deeply worried by how the holiday became taken over by commercial and private interests. They were very nervous about corporations, Brugman said. It wasn't that they forbade them, but they saw corporations as like little republics that potentially threatened the power of the republic. Coe, who is also a fellow at the Washington think tank New America, said by now, the day is devoid of recognizable traditions. There is no moment of reflection, Coe said. Given today's widespread cynicism towards the office, she added, that sort of reflection would probably be a good idea. So, in our Enlightenment Hour today, I implore you to reflect a little bit. After reflecting on the life of, President Washington himself, happy birthday, old Georgie. Thanks for all you did for this fine, fine country. Hope you're proud of what it's become. Maybe there's some things that happen in a growing process, but America's still the best. She's the greatest. All right. Herbal Wellness Corner, brought to you by Hires Cannabis Company. If you're shopping cannabis today or every day, if you're shopping High Horse, 24/7, 365 here in Las Cruces. Chaparral State Line, Hobbs State Line, 7 a.m. to midnight. All right, so funny enough, let's talk about the Puff puff potus. Historical use. We're lightening this up a little bit, right? It's the herbal wellness corner. George Washington pick, pretty awesome. Hilarious, right? Anyways, politics is a serious business, but even for some of the most stoic leaders, have indulged in moments of repose. After all, everyone needs to blow off some steam sometimes, even the heads of state. Let's take a break from the weighty matters of the world and explore the hazy history of presidents who've gone dancing with Mary Jane. Grab that bag of chips, get cozy, and join us on a romp through professional history, cannabis style. This is from Wink, Seltzer, and THC, so I think this is hilarious. George Washington's cannabis endeavors, exploring the first president's connection to cannabis. George Washington, the OG of American presidents, as we just talked about, wasn't just about cherry trees and crossing the Delaware. It turns out the birthday boy had a whole other side hustle going on. In his diary, he dropped gems like sowed hemp at the Muddy Hole by Swamp, according to Mount Vernon Estate. The hemp pole Washi grew was used solely for rope and other industrial applications, but we have to ask, was that really all it was for? Thomas Jefferson, how about that? Then there was the founding father who was ahead of his time, Thomas Jefferson. This guy wasn't just drafting the Declaration of Independence, he was also cultivating hemp like a bad man. He was so into his hemp, he even smuggled hemp seeds from China. Well, there's no solid evidence that he was rolling up fat joints on the side. His fondness of hemp suggests that he might have been more chill than we thought. Maybe Jefferson was even brewing some tea or creating herbal remedies. John F. Kennedy secretly relieved the role of cannabis in his health. JFK, the personification of style and elegance. But did you know that the Camelot might have had a little sticky green in its gardens? Turns out JFK wasn't just dealing with the Cuban Missile Crisis, he was also struggling with some serious back pain. According to the book John F. Kennedy, a biography, rumor has it JFK smoked a few dubs with his mistress, journalist Mary Meyer. He didn't feel the first 3 hits, but by the 4th he remarked, imagine if the Russians pulled something now. Who knew under all the sophistication was the heart of a stoner? Then there's Bill Clinton. Next up. Remember when he famously claimed he didn't inhale? Classic. Whether you believe him or not, now you got to admire his crack at straddling the line between I'm cool and hip and I'm presidential. Hey, we've all got to find our own ways to navigate those tricky questions about past indiscretions, right? According to biographer Christopher Hitchens, Clinton had a thing for pot brownies, so whether or not he actually inhaled might be irrelevant. George W. Bush and cannabis confessions. Next up, George W. Bush, the cowboy president with a rumored taste for the green stuff. According to J.H. Hatfield, author of the book Fortunate Son, George W. Bush and the Making of an American President, Bush was arrested in 1972 for cocaine possession, but weed? We're not too sure. Well, he's been tight-lipped about his alleged pot-smoking days. Gossip from his college years suggests he might have taken a trip to the groovy side. Sometimes you just got to let loose and embrace your inner stoner, even if you're destined for the White House. He later told his biographer Douglas Weed, yep, pronounced like weed, I steered clear of cannabis questions. You know why? Because I don't want some little kid following in my footsteps. So that's, might as well call that a mission. Barack Obama, the first POTUS to actually admit he liked it. Before he was dropping mic moments left and right, he was dropping something else, joints. On the campaign trail in 2008, he famously said, when I was a kid, I inhaled frequently. That was the point. In his memoir, Dreams of My Father, the former president, straight up admits getting baked during his younger years in Hawaii. In fact, Obama's group of pot-smoking friends even had a name for themselves, the Choom Gang. Legend has it that Barry was so committed to the mission that he turned into smoking into a competitive sport. According to David Maranese, the book Barack Obama, the story, if you couldn't hold your exhale with the Choom Game, you'd get slapped with the penalty and sidelined for the next crowd. It's like he turned the passing the joint into a high-stakes game where one false move could leave you watching from the sidelines. Now that's taking puff puff pass to a whole new level. Hilarious. Funny stories there from our presidents. Whether or not they were using it for medicinal reasons or not, I can't say Barack Obama was. But anyways, Community Spotlight, guys, brought to you by the Big Chicken Farm. Shouting out Chachi's opening up their location downtown, coming soon on 340 North Main. How cool is that? Congrats, Chachi's, their third location. Definitely delicious food. Mateo's delicious food downtown. Glad to add Chachi's to the mix. Downtown's a very vibrant place and needs all the great food. Awesome. Our last thing, guys. Men's Health Minute brought to you by Vado Speedway Park. We're going to be cruising 1912 through 1920 presidents who changed healthcare in America. So, for our President's Day special, let's do a little review. So, according to Forbes here, since 1789, Americans have sworn in an elected official as the President of the United States. And since George Washington took his oath in office on April 30th of that year, the health of Americans has been top of mind. However, what that means and what the role the federal government has played has changed significantly over the years. In fact, it wasn't until the 26th President Theodore Roosevelt said that social insurance, including health insurance, was even considered in a presidential platform. Despite Teddy's efforts to create a national healthcare system, his re-election campaign in 1912 failed. Subsequently, the years following the Great Depression, Americans began to think in new ways about social programs and policies. But it wasn't until his distant cousin, Franklin Delano Roosevelt, the 32nd president of the United States, that national health insurance was again at the forefront of a president's mind and campaign. FDR was an advocate for mandatory health insurance in both the Social Security Act of 1935 and the Wagner National Health Act of 1939. Fortunately for him, both efforts failed to accomplish all that he had hoped for in the national health reform. However, he did oversee some public health creations like the Department of Health and Human Services, originally the Federal Security Agency, which brought together federal agencies related to health, welfare, and social insurance. From that point forward, healthcare and policy have been an integral part of the American history and presidency. 5 in particular were successful in changing health policy as we knew it, and here's a brief history of those presidential change makers. 1. FDR. Assuming the presidency during the Great Depression, President Roosevelt was able to create sweeping reforms during his 4 terms, including the New Deal that greatly expanded the role of federal government, including many aspects of employment, agriculture, emergency relief, and health. He was also stricken with polio, making him the first president with a known disability and crippling disease. Harry Truman. President Truman let it be known that he believed his greatest failure as president was not getting a national insurance program during his tenure. In a draft message to Congress in 1947, Truman wrote, "Healthy citizens constitute our greatest national resource. As a nation, we should not reserve good health and long productive life for the well-to-do only, but should strive to make good health equally available to all citizens." While he didn't accomplish national health coverage, he does get credit for being the father of Medicare and for passing the National Mental Health Act, thus creating the National Institute of Mental Health. Then there's Lyndon B. Johnson. In 1965, a significant year for health reform, as both the Medicare and Medicaid programs were signed into law. He made health reform and expansion his #1 priority, noting throughout the 1964 election that it would be his first initiative after his inauguration in January of 1965. And he put the issue of health reform front and center in his State of the Union the same month. It only took 6 months before he was able to travel Independence, Missouri, and sign Medicare and Medicaid into law next to former President Harry Truman. Then there's Richard Nixon. By the 1970s, healthcare was a required part of any campaign for federal office. With all candidates having their own health reform proposal, however, it was Richard Nixon that made a significant change to Medicare, allowing those under 65 with long-term disabilities and end-stage renal disease to access services. In 1974, he presented his comprehensive health insurance plan, the CHIP, to Congress, saying, "Without adequate health care, no one can make full use of his or her talents and opportunities. It is thus just as important that economic, racial, and social barriers not stand in the way of good health care as it is to eliminate those barriers for good education and a good job." Lastly, regardless of how one may feel about this president or not, especially considering the recent times, he made the list. Barack Obama, the 44th president of the United States. Barack Obama brought universal health coverage back in his spotlight with greater success than his predecessors of the previous few decades. And in 2010, the Patient Protection and Affordable Care Act was signed into law. While the Affordable Care Act did not accomplish many of the national standards the president had hoped, it opened the door for significant changes to the status quo and ensured that for decades to come, his benchmark reforms would be the starting point for all future health reforms and technologies. While many presidents of the United States have made incremental changes to federal health policy and the American psyche, It has often been those changes that affect our social determinants that have the greatest influence on our access to have better healthcare and the prevention of disease. However, a few bold moves, sometimes taking decades, like those noted above, change the course of American health policy and care. And it is certain that no campaign for the highest office in the land will ever be able to ignore health policy again, and it has become a cornerstone of the office of the President of the United States. So salute to all those on President's Day. Hope everybody had a great one. It was a good night.